Senator Kaine.
Thank you, Mr. Chair, and congratulations to our nominees. First, a comment to my colleagues. Since our last health meeting, the Secretary of Education, who is under the oversight jurisdiction of this committee, has announced the pausing of $6.2 billion of education funds to our states. And I just encourage my colleagues to talk to your state officials and see what this means. Over the weekend, I had a chance to meet with the Boys and Girls Club of Roanoke, which serves Appalachian, Virginia, 850 families, 850 kids and their families in before school, after school, and summer programs. These pauses of funds from Secretary McMahon is 60% of their budget. I'm meeting with my Boys and Girls Clubs from all over the state today. I'm expecting to hear similar. The Secretary gave no reason for the pause, no indication whether or when the funds might be restored. These Boys and Girls Clubs essentially start their programming when the school year starts, which for many of my jurisdictions is in 1 month, and they don't know whether they can keep the doors open. I hope we might have a further discussion about this on the committee when we next have an education-focused hearing. Dr. Christine, about 18% of Americans have experienced long COVID at some point in the last 5 years. 25% of people who currently have long COVID have debilitating symptoms, unable to work, housing insecurity, mental health challenges, and other challenges. I've been pretty open on this committee since January of 2021 about my own journey with, thankfully, mild long COVID symptoms that have not gone away in 5 years. And others, senators, both Democratic and Republican, members of this committee, current and former, have also shared long COVID experiences, both personally and of family members. Given the Secretary's goal to address chronic conditions, I was disappointed that the administration ended the Department of HHS's Office of Long COVID Research and Practice, which coordinated a whole series of government efforts to look at research, causes, cures, treatments. The administration has also undermined the Agency for Healthcare Research and Quality, which established a long COVID care network. Let me just ask you this. Do you believe that long COVID is real?
So, Senator Kaine, number one, thank you for being here today. Thank you for taking the time.
Can I just say this? You don't need to thank me for being here. My Virginians sent me here, and I thank them. I'm supposed to be here. I'm just doing my job, and I don't need a thank you from anybody for just doing my job. But I'd like to hear whether you think long COVID is real.
Sure. Well, certainly the COVID pandemic was devastating for this country, devastating in the loss of life, the individuals who suffered, and as we've said, devastating to the prior administration's approach and causing the loss of confidence.
And how about President Trump suggesting light as a treatment or injection of ivermectin? You talk about loss of confidence, and you want to put it on somebody's shoulders, and you're ignoring a whole lot of misinformation that was perpetrated by the previous information. But that's not the question I asked you. I asked you the question of whether long COVID is real.
Well, we certainly need to continue to collect data on individuals who've suffered from COVID.
So you're not sure about whether long COVID is real or not? Would that be a fair statement?
So we need to continue to collect data.
Okay, I'm going to take that as you're not yet sure about long COVID. Do you think long COVID is a chronic condition?
I think that absolutely. We are early on in this experience with COVID, just a few years, which is just a blink of an eye.
Okay, so you haven't reached a conclusion yet. I find it puzzling that Secretary Kennedy says he wants to focus on chronic conditions, but he's undermining and shutting down an office that was designed to look at a chronic condition. Let me ask you this. As a provider, would you recommend your patients get a COVID vaccine?
I think that COVID vaccine, like any medical therapy or any vaccine, is going to have inherent risks and benefits.
Would you recommend that a patient of yours gets a COVID vaccine?
When I've practiced medicine in these over 3 decades, I've always hinged my practice on informed consent.
Okay, let me ask you this. So you've practiced medicine for 3 decades. Have you never recommended to a patient who've said, hey, doc, you're an expert, I'm not. What's your recommendation? When somebody says that to you, do you give them a recommendation?
Certainly within the realm of urologic surgery, I've given recommendations.
Okay, so you give them a recommendation. So, but you would not feel comfortable giving a recommendation to a patient to get a COVID vaccine?
What I would feel most comfortable with is making sure that the patient has access to good information.
Okay, well, that is pretty darn troubling, as was your answer in the question that Senator Hassan asked. She asked all witnesses whether if you were given a directive by the President or Secretary that you thought violated the law, would you follow the directive or follow the law? Your other panelists said, I would never be given such a directive, but I will always follow the law. You were the one witness who could not make yourself say that final clause, that you would always follow the law. And I think a lot of people noticed that. I yield back.